Good afternoon. My name is Hannah. I'm a nurse practitioner student. So today I'll be performing a head-to-toe assessment for your yearly exam.
Okay.
Before we get started, do you have any questions?
I do not.
Okay. Before this video, I have washed my hands to prepare for the exam. We have already done the vital signs. I have done the general appearance of this patient. She is healthy appearing. She's well dressed. Can you tell me the year?
2023.
Okay. Can you tell me what month we're in?
February.
Can you tell me where we are right now?
Moultrie, Georgia.
And who is our president?
Joe Biden.
Okay. With those questions, I'm able to assess her orientation. She's alert and oriented ×4. Her vital signs, we did her height is about 5'5". She is 130 pounds with a BMI of 21.6. Her blood pressure was 105/54. Respirations were 17. Her pulse was 72, and her temperature was 98.4. Okay, next on our assessment, I want to check your skin. And with this assessment, I'm looking for color distribution, and yours is even throughout. I'm going to check your capillary refill, and it is less than 3 seconds. The skin is warm and dry, good turgor. I'm going to palpate your head. Okay, a little taller than me. I'm just going to palpate and check the scalp for any kind of lesions or abnormalities, and with you, I'm noting none. I am going to check your temporal pulses. And I'm noting that they are bilateral. Can you smile, raise your eyebrows, and then puff out your cheeks? Okay, that shows me that your cranial nerve 7 is intact. Can you clench your jaw for me? Are you noting any tenderness on any side?
No.
Okay, that shows me that CNN 5 is intact and no tenderness was noted. Next, I'm going to take my pen and I'm going to kind of poke you with it one end, and then it's going to be kind of dull on the other end. Tell me what you feel, okay?
Dull. Dull. Sharp. 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 Dull. Dull.
Okay, so that the sensation was bilateral and equal on both sides. Okay, for the next assessment, I want to take a look at your eyes. I want to note that your eyebrows and eyelashes are evenly distributed. There's no signs of any kind of drooping. Your conjunctiva is pink and moist, and your sclera is white and doesn't have any signs of opacities in it. At this time, we would use a Snellen eye chart to test this patient's vision, and for the reasons of this video, this patient has 20/20 vision and her CN2 is intact. Okay, so next I'm going to test your field of gaze. I'm going to stand kind of in front of you, and it's sometimes easier to follow this instead of my finger. So I want you to follow this pen with your eyes, okay? Okay, very good. This is testing the cranial nerve 3, 4, and 6, and it is intact. Next, I'm going to wiggle my finger on both sides of your face, and I want you to tell me if you can see it, okay?
Mm-hmm. 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 Mm-hmm.
Okay, so that shows me that the whisker test was positive. So now I'm going to turn off the lights, and I'm going to grab my pen light, and I'm just going to assess your eyes, okay? So can you cover your left eye for me?
Oops, sorry.
That's okay. Very good. Very good, and you can take it off real quick. Very good. I'm going to turn this light back on. So with that test, I was able to see that your pupils are equal, round, reactive to light, and accommodation. So that shows me that your cranial nerve 2 and 3 are intact.
Okay.
Her pupils are round and are about 3 millimeters. We do not have access to an ophthalmoscope, so I was unable to assess the patient's red light reflex, but if we were in the office setting and had access to one, I would be able to test and get the red reactive test. Next, I'm going to take a look at your ears. And for the sake of this video, I'm only focusing on this side, but it would be a bilateral assessment that I was doing. Now I'll kind of just pull on it a little bit. Any tenderness?
No.
Okay, no tenderness or lesions are present. There are lines, height and equal both sides. Okay, now I'm just going to take a good look at your ear canal, okay? Sorry if it's cold. Okay. No drainage is noted here on this assessment. Your tympanic membrane is pearly gray. The cone of light shown around 7 on the left and then 5 on the right. Okay, so next I'm going to test your hearing. I'm going to kind of stand behind you a little bit. I'd be more behind her in the middle. And I would ask her if she could hear me repeat these words. Okay, so ABC.
ABC.
1, 2, 3.
1, 2, 3.
And that would just be testing that she was hearing those words equally bilateral, showing that the CNA, cranial nerve 8, was intact. Okay, and in this part of the exam, to test hearing, I would also use a tuning fork, but again, I do not have access to one of those. To test the Ryan and the Weber test, we would take a tuning fork, get the vibrations going, put it in the middle of the forehead, and if she was able to hear the sound both ears, that's a good normal sign. And then for the Ryan test, I would tap my tuning fork, get their vibration, and then put it on the bone. And so in that case, a normal finding would be the air conduction will be greater than the bone conduction. Next assessment that we will do is to take a look at the nose. I'm going to stand in front of my patient and see that the nose is midline to the body and has no deviations. Next, I'm going to take a look in the nose. And with that assessment, I was able to see that the nasal mucosa is pink and intact, and the nares are patent bilaterally. She doesn't have any congestion going on today. And I'm going to palpate your maxillary sinuses. Let me know if you feel any tenderness.
Mm-mm.
No tenderness noted with that assessment. Okay, so for this next part of the assessment, I'm going to put on gloves and assess your mouth, okay? You can open up and say, ah, really big. Okay, very good. And can you say light, tight, dynamite?
Light, tight, dynamite.
Okay. I assessed her mouth and throat and her hard palate, buccal mucosa, tongue, and posterior pharynx are pink and moist. Her uvula and soft palate were intact. Her frenulum is midline, her tonsils are not visible, and there's no drainage in the back of the throat. And there is no redness, edema, or exudate noted. And the cranial nerve 9, 10, 12 were tested and are intact. Okay. So next I'm going to move on to the neck. Can you move your neck around for me? Okay. I'm just going to put my hands right here while you do that as well. Are you noting any tenderness?
No.
Okay. Can you swallow for me? So the trachea is midline without any deviations, and she doesn't have any tenderness in her neck when she moves it around. All right. Okay, so for the next part of the assessment, I want to check your lymph nodes, and for the camera, I want to kind of stand to the side, but I'd probably be more in front of you for the exam. I want to feel for your preocular, your postocular, your occipital, your submental, submandibular, tonsillar, superficial cervical, posterior cervical, and your supraclavicle. Any tenderness noted?
Mm-mm.
Okay. For this exam, lymph nodes were not palpable and they were non-tender. Next, I'm going to check your thyroid. Can you swallow for me? Any pain or tenderness? Okay. So there's no enlargement of her thyroid, no pain or tenderness noted. So next we're going to move on to the shoulders and your upper extremities. Okay, moving on to the shoulders, I'm going to palpate some lymph nodes in this area. Okay, so I have palpated the auxiliary, central, lateral, pectoral, and subscapular lymph nodes. They're not non-palpable and non-tender. I've already inspected when I was doing all the other assessments, the shoulders and clavicles, and they are symmetrical. I'm going to palpate the shoulders, just looking for any signs of any tenderness.
No tenderness.
Okay, very good. Can you roll your shoulders for me? Kind of move them around, get them all loose. Very good. So no restrictions or clicks or anything are noted. I'm going to kind of put some pressure on your shoulders here. Can you give me a big shrug? Okay. So that is showing that her cranial nerve 11 is intact. Okay, next I want to check your epitrochlear node. In this elbow region, can you move it for me? Any pain or tenderness? Okay, so there's no tenderness or deformity noted, and her range of motion is intact. Okay, next I'm going to check your arteries. I'm going to start with your brachial. Okay, I'm going to move down to your radial. Very good. Her radial and brachial pulses are noted at about a 2+, and they are, in the case of this video, I'll stand on the side, but you want to check to make sure they are bilateral. And in this case, they are 2+ bilaterally. Can you squeeze my hands for me? Can you pull me towards you? Push me? Very good. So she has got 5 out of 5 strength. So next with our assessment, I'm going to check out your chest. I've already noted that the chest wall is symmetrical and she has about the 1 to 2 AP diameter noted. So I'm going to listen or palpate and then listen to your carotid arteries. Okay, now I'm going to listen to your heart, okay? I'm going to start with the aortic, pulmonic, tricuspid, sorry, it's getting a little personal there, and then the mitral. Okay. So it is noted that her rate and rhythm was normal. There was no abnormal heart sounds. S1 and S2 were intact and heard. S3 and S4 were not present. The PMI is located at the 5th intercostal space at the left mid-clavicular line. And then I'm just going to take a listen and get some breath sounds. All right, I just want to take you to take a few big breaths for me. Very good. Very good. I'm going to get up under here. Very good. Very good. Just a few more for me, okay?
Mm-hmm.
Very good. So her breath sounds were clear. There was no adventitious sounds noted, and she breathes normally with no use of her accessory muscles. All right, so now I'm going to stay on your back right here, and I'm going to palpate for some tactile primitives. While I'm doing this, can you say 99 for me?
99, 99, 99, 99.
Very good. Now I'm going to percuss, okay? Okay, very good. And I'm going to put my stethoscope back on, and I'm going to listen. And while I'm listening, I'm going to have you say the letter E, okay? And I'll tell you when I'm ready.
Okay.
Okay?
E, 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 E.
Okay, very good. There's clear breath sounds, no adventitious or diminished breath sounds noted. Okay, so next we are going to move on to the abdomen, okay? So I'm going to have you lay back for this one. Now I'm just going to take a look at your abdomen. I don't notice any discoloration or lesions. It's symmetrical and flat. I'm going to take a listen, okay? Bowel sounds are present in all 4 quadrants and no bruits are heard. Now I'm just going to percuss, okay? Okay, and then I'm also going to just feel for your liver's edge. Okay, and then we are going to palpate, okay? Let me know if you feel any tenderness. Okay. No tenderness or inflammation noted. I'm going to kind of give it a little bit of a bigger press, okay? Let me know if you feel any tenderness.
No.
Okay. So there is no tenderness or any kind of masses felt. Now I'm going to push on your left side. Let me know if you feel any pain.
No.
You don't feel it in the right side? Okay. And then I'm going to bring your leg up. Any pain?
No.
Okay. All right. So now while I'm down here, I'm going ahead and just palpate your bladder, okay? Okay. Any tenderness?
Mm-mm.
All right. No tenderness noted. All right. So next I'm going to move on to the lower extremities. But before I sit you up, I want to check your hips, okay?
Okay.
When I'm touching like this, do you feel any pain or tenderness?
Mm-mm.
Okay. No tenderness or deformity noted. Next, I'm going to check your range of motion in your hips. I'm just going to roll your legs out like that. No signs of clicking. Any pain?
Mm-mm.
Okay. No pain noted. And she has full range of motion in her hips. Before I sit up, I want to test your ligaments in your knee, okay?
Okay.
So this is called the drawer test. Well, it's kind of weird. I have to sit on your foot, and I want to kind of pull.
Mm-hmm.
Any pain or tenderness there? Okay. For the sake of this video, I'll just do it on this side, but I would also assess the left knee as well. Okay, so you can come and sit on up. Okay. So I'm just going to take a look at your legs. If you'll just kind of push them out for me, pull them back in. Any tenderness? Okay. And so I'm going to keep moving on down. I don't notice any swelling in her lower extremities. I'm going to just check for some pulses, okay? Okay, and they are bilateral. Now we are going to check your range of motion in your ankles. Can you kind of just move them around for me? Very good. And I want to come in front of you. If you'll just, with both feet real quick, pull me, push me. Any pain or tenderness when you do that? Okay, so with her lower extremity, there's no swelling or any signs of edema, tenderness, and she's got full range of motion. And so I want to test for sharp and dull pain on you, okay?
Okay.
So I'm just going to kind of squat down right here so I'm make sure I'm still in the camera. And I'm just going to kind of go in spots on your leg and you tell me if it's dull or sharp, okay?
Sharp. Sharp.
Sorry.
Dull. 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 Dull.
All right, very good. So her sensation is also intact, and she has 5 out of 5 muscle strength in her lower extremities. Okay, next, I'm going to check some reflexes. Okay, just relax your arm for me. And I would do this all bilaterally, but to get to the arm, I would have to get in front of the camera, so I'll just... Okay, so in that I tested the bicep reflex, the tricep reflex, the brachioradialis reflex, the patellar reflex, and the Achilles reflex, and all of them were normal. And for the case of this exam, I'm not going to have my patient take off her shoes, but if we were in the office or in the clinic, I would have her take off her shoes and test for the Babinski reflex at the bottom of her foot. In the case of this patient, it is negative. Okay. So next, I'm going to just take this little cotton ball swab, and I'm going to have you close your eyes, and I'm going to place it somewhere on your arm, and when I remove it, I want you to tell me exactly where it was, okay?
My forearm. My forearm. My wrist.
And then I would also do that on that side as well, but I'll just go ahead and do it.
My forearm. Forearm. My wrist.
Okay, very good. So there is normal light touch sensation felt in the correct spot with this patient. So now I'm going to have you, this is testing your coordination of your upper extremities. So I want to have you all hold your arms out like this, and I want you to alternate touching your nose. Very good. Sorry about that. All right, so the coordination of her upper body is intact. And so now I'm going to have you test the lower extremity. So I'm going to have you take your heel of your foot and start on your knee and just slide it straight down. Very good. Okay, very good. The lower extremity is also intact and it's smooth and coordinated. Okay, so I'm going to have you stand for the rest of this exam. up. Sorry about that. All right, and this is going to, I want you to just move around. Very good. I'm testing the range of motion in her spine. Any pain?
No.
Okay, so it is intact and she's got full range of motion. Now I'm going to assess your gait. I want you to walk straight and I want you to do heel to toe, okay? Very good. This patient maintains a straight line and can maintain her balance. Okay, so now I want you to close your eyes and stand still for me. Okay, there's no swaying present, so she has a negative Romberg test. All right, so we are finished this exam. Thank you so much for being patient with me as we work through it. Do you have any questions for me today?
I don't think so.
Okay, well, thank you so much for your time, and I hope you have a great day.
Thank you.